Are you in every way, woman?
We're back to continue the conversation on breast cancer prevention and awareness. Dr. Kapoor, tell me more what we can do to prevent breast cancer.
Yeah. So there's a few things that are really important. It has to do with what we take into our body and what we do with our body. So are we exercising enough? This is a big deal. We try to downplay it, but being overweight, being obese, especially postmenopausal obesity, is a huge risk factor. It can triple your risk of breast cancer.
Triple.
So we want to be watching our weight. We want to be exercising, not just, oh yeah, I went for a walk today. I walked, 20 minutes, five times a week for 30 minutes, and actually not just the casual stroll in the park, but getting your heart rate up. Yeah, that's going to be really important. Yeah.
That's a lot of work.
Yeah, and so it's
hard,
right? This is hard. Now think about, do you really, how much do you do? How much do you exercise?
Oh, yeah, because I do maybe like one stroke.
Right, so that's our role. We got to push women. This is why you're doing it.
Is there specific exercises that we should be
getting your heart rate up?
Just
everybody's body is different. Some people can't do things because their wrist is screwed up. Some people can't do things because their ankles are not working or they got weak knees. So you can swim, you can jog, you can actually just go upstairs.
I'm going to take it there. Women who have gone through breast cancer treatment, sex. That's cardio.
That's cardio.
So,
okay. Can you get a partner to last 30 minutes?
I don't know. You should answer that.
I'm just gonna leave it there. But all seriousness.
30 minutes, 5 days a week of cardio is going to be
So wait,
important.
sex 30 minutes, 5 days a week.
Oh,
Is that a reference? Oh, is that good?
So moving on to other prevention.
Vitamin D.
Okay.
I know I keep harping on this, but I've read so much about it.
Yeah, so vitamin D is really important in general. It's a vitamin we don't get easily. We're supposed to get it from the sun. But if we're wearing sunscreen or if we're darker, actually, you and I both will not be absorbing it very well from the sun.
Why is that?
So dark skin, the pigment won't let us absorb it as well. So for darker skin people, for people who are overweight, for people who are older, over the age of 70, are not absorbing it enough. If you're wearing sunscreen or you're not in the sun.
I mean, people in the Midwest or the East Coast, they're not getting this California sunshine.
Right, and actually we fool ourselves thinking just because we live in California we're getting enough. We really don't. If you actually test the blood level for most of us will be low or deficient. Wow. So vitamin D is important in general for our bones, for our muscle, our development. It's actually good for immunity. We also know for women who've had breast cancer, if you have a very low level of vitamin D, you're more likely to get cancer come back. So we do check vitamin D levels for our cancer patients and make sure they at least have a normal level.
Okay, Dr. West.
Yes.
Surgical prevention, the Angelina Jolie effect.
Sure, it's a story that's obviously earned a lot of attention. So a patient like that usually starts with actually Dr. Kapoor. But somebody who comes in and they either have a strong family history or in Angelina's case have been found to have a BRCA mutation. Dr. Kapoor can talk to you a little bit more about BRCA1 and BRCA2. But these are women who are at extremely high risk for breast cancer, anywhere from a 60% or higher lifetime risk of getting cancer. Those patients usually start their journey with Dr. Kapoor to talk about the pros and cons of having a prophylactic mastectomy. I don't know if Dr. Kapoor, you want to address that?
Yeah, I mean, the fear of having a breast cancer or the likelihood, if it's that high, of developing a breast cancer, can we do something more? Removing your breast decreases your risk quite a bit, tremendously, almost down to 1%.
But it's not for sure.
It's the biggest thing you can do to reduce your risk of breast cancer would be to remove both your breasts.
When do you know when it's okay when you're through the stages to remove them, though? That's my question. Like, when do you decide that?
I usually advise my patients to try to get through childbearing if they can, or at least get to an age where they're comfortable. Don't want to do this for an 18-year-old who's barely through puberty. You're not going to get breast cancer that young, right? Most women are going to, even with the gene mutations, are not going to be seeing breast cancer at least into their 40s or 50s, sometimes earlier, though.
But okay, so let's say they've had this mastectomy before they have children. Are they still able to breastfeed after reconstruction?
No, because we want to remove all the ducts and the glands, right? So that's one thing.
So the reconstruction's then purely aesthetic.
Well, I think it's aesthetic and it's psychological. I think you have a woman who goes through, traditionally we think of a mastectomy as being a really disfiguring procedure. And 20 and 30 years ago, it was a very disfiguring procedure. These days, you can rebuild somebody to look very much like they looked before the surgery, which completely changes the way that people think about prophylactic mastectomy. You get people in the news responding to Angelina saying, why would she do that? Well, if you know you have a 60+% lifetime risk of getting cancer, but you can have a procedure that brings it down to, let's say, 1%, and still look almost as good as you started before the surgery, why would you not have a surgery that could potentially save your life?
So is it a full double mastectomy, or is there a way of keeping part of the breast?
Yeah, we save the skin and nipple, and so
yeah, you essentially save everything that you're able to see. The breast tissue that's inside is removed, but everything on the outside, the skin and the nipple are there, and we replace the inside with an implant or another type of reconstruction. And quite frankly, we can have women who come in looking exactly like they did before their cancer, or before their whatever surgery they've chosen.
That's incredible. Thank you so much for this information. For more on breast cancer prevention, go to breastlink.com or everywaywoman.com, and we'll see you next time. Thank you, doctors.
Thank you.
Are you in every way woman?